Hello, my friends. Today we have a very special guest on the show. Her name is Dr. Amy Beckley. She is the founder of Proov and the inventor of the first and only FDA-cleared test to confirm ovulation at home. And I'm really excited to get into this incredible testing kit that she's created and offers so many women who are not only trying to conceive, but women who just want to become more body literate, understand their bodies and how they work, and really be able to use our menstrual cycles as our fifth vital sign so that we can become empowered about our health. So, without further ado, hello, Dr. Amy. How are you doing today?
I am doing fabulous. Thanks for having me.
Thank you for being here. And as I usually start off, most of my guests on the podcast have their own kind of personal journey and story into this fertility space. And you've obviously you do lots in the fertility space with regards to educating and empowering women, giving us tools and resources to help us again become body literate. So, I would love for you to share with the listeners how that all came to be.
Yeah, absolutely. So I'm a scientist. I have a PhD in pharmacology. I just love science and understanding how the body works. I've done vaccine development. I've done like what determines when your breast cancer is going to metastasize into the lung. So I've always just really been passionate about science and understanding, what happens and what can go wrong. And so I just built my career off of, being a scientist, and got married and moved to North Carolina, where I did a postdoc to kind of further study. And we decided to buy a house and got a dog and all that fun stuff. And next was the baby. And it was surprisingly hard. It was just not something that came easy. Here I was a scientist. I was doing all the things. I was doing the thermometer, like, trying not to move when I'm sleeping, and then like slowly turning over and like putting the thermometer in my mouth, and typing. This was back in the 2000s, where we had like wearable thermometers, but taking ovulation tests, and I could tell something was not right with my cycle. It was very long. Sometimes I wouldn't get a positive ovulation test. If my temperature did increase, it'd go up a couple days and come back down. But doctors wouldn't really help me. They said, well, you haven't been trying long enough. You've only been trying 4 months. And I'm like, yeah, but there's obviously an issue.
Mhm.
um, but then finally I got pregnant, and it was on my birthday, as we celebrated. And then my birthday is in April. And so 2 weeks later is Mother's Day, and we were celebrating our first Mother's Day. And I got up from lunch, and the gush and the loss of my first pregnancy. Um,
Mm.
and silver lining was, oh, well, at least now I can have a reason to go back to the doctor. Maybe they'll take me seriously, that there is something wrong. No, it was, 25% of miscarriages or of pregnancies end in miscarriage.
Yes.
It's normal. It's common. Go back and try again. Chances are it won't happen again. It did happen again. And, they said, well, we can't really do any testing until you've had 3 losses or you've been trying 12 months. And so we just tried. And I call it the pit of despair. Every single month you get the negative pregnancy test, and it's just one notch lower, down, down, and down. And you feel like it's never going to happen. And you just go in this spiral. And like, for me, I felt like less of a woman, that I couldn't do something so simple as conceive. And it was like my entire life was on pause because I just wanted to have a baby and start my family, and I couldn't do it. And I just, nothing else mattered. Like, you just focus on the next time you take an ovulation test. Every time you pee, you're staring at the cervical mucus. Like, it's all consuming,
It's all
right?
consuming.
And
Absolutely.
you feel like you have absolutely no control whatsoever, because you just have intercourse, and hopefully, and cross your fingers and wait for the pregnancy test and wait and hope that it actually progresses and everything's good. And I just felt so out of control, and I felt not supported. But we did, hit that 12-month mark. And I went to go see reproductive endocrinologist, and we tried again. I had a couple other losses. And then finally we set out to do IVF. And so I had all the testing, everything came back normal. I was given the diagnosis unexplained infertility, which was the worst thing you can do to a scientist, is say, we don't know what's wrong with you, but here, take this $20,000 procedure to make it right. I'm like, oh, okay. But I was, 3 years in and like 7 miscarriages, and I was just so broken that I was like, I've got to just, I just like, this is the best chance I have. I don't know what's wrong with me, but this is the best chance. It's like a medical band-aid. It fixes everything. It's like, we don't care what's wrong with you. This is just going to fix everything that possibly could go wrong. So we did it, and 2 cycles. My second cycle was successful. I have a 12-year-old son. I tease that I named him Cash because he took all of our cash.
His name is Cash. That's
It is.
awesome.
It is. Yes, yes. I actually bought him this little like costume that's a money bag with
Yeah.
like the money on top. And so every year I make him wear it. It's like we've had to cut off the bottom, and he wears it as a shirt now as he gets
Oh, that's
older.
awesome.
Yeah, yeah. So
Great way to bring humor into all of it.
I mean, you have to. Like, it's
You
so
have to.
deadening. Like, this whole process is just so like life sucking that you're like, you have to celebrate the joys.
Hmm.
So anyways, when my son was about 2, I turned to my husband. I was like, yep, I am crazy, but I would like to do this again. I'd like to have one more child.
Hmm.
But this time I decided I wasn't going to do IVF. I was going to walk into my reproductive endocrinologist's office. We were going to have heart-to-hearts, MD to PhD conversations. We were going to figure out what that missing link was. And so through a series of conversations, it was, I could get pregnant. I just couldn't keep a pregnancy. What could possibly be causing this? And I always came back to the idea of like during IVF, I would inject myself with progesterone, and progesterone is the hormone that's required to maintain a pregnancy. And going back to my charting, my temperature typically never got above like 98 degrees. And if it did, it was kind of like jaggedy and it would come down too soon. And I would have really short luteal phases. So luteal phases between ovulation and the next period start. I would lucky if I got 10 days, lucky. And so
Hmm.
I was like, I have a luteal phase defect. Doctors don't like that term. They don't know that it exists. They're not really sure they like that idea. And so I said, well, maybe I just don't have enough progesterone. Can I just take the progesterone as, but they do an IVF, but let's skip the IVF part. We'll, conceive naturally at home, and then I'll support my luteal phase with progesterone.
Hmm.
He's like, yeah, sure, we could try it. I mean, like, progesterone is a great hormone. You can't get enough of it. It's a happy hormone. I mean, women use it for menopause all the time. It's like, all right, cool. So I did that. And within a couple cycles, I was pregnant again. And this time it turned into my 9-year-old daughter. And I
Hmm.
was like, wow, something so simple as that is what we were missing this entire time. And they did all these blood tests and everything, and they would just say, oh yeah, you have enough progesterone, you ovulated. But like it's like a single blood draw is not diagnostic to tell you, if it was a good ovulation, right? So we have good eggs and bad eggs. So, egg quality we've talked about, like, okay, what can you do to support egg quality? It's like, well, what about ovulation health? How do you support a healthy ovulation? Ovulation is not just the egg popping out of the ovary and becoming fertilized. It's also preparing the uterus for implantation and growing the pregnancy. So in the
Right.
beginning of your cycle, you have to have estrogen that builds that lining. And it's like this cushy pillow for that baby. And then once you ovulate, the ovary makes progesterone, which makes it receptive, and it makes your uterine lining stable so that you can implant. And so at any time you don't have enough progesterone, or your progesterone drops too low, then you're either at the risk of infertility, miscarriage, or preterm birth if you're that far along in your pregnancy journey. And so progesterone is this, super important hormone that, by doing a single blood draw, we're not looking at it in time.
Hmm. Hmm.
And so, they were just missing what was going on with me. And so I decided, you know what, I was lucky enough to build my family, and I went through basic hell and back, and I wanted to give back to the community and say, I don't want people to live through this if they don't have to. Can we create better diagnostics, better solutions to give a better voice for patients and physicians to communicate together to lead to that faster treatment option? And so we invented this urine-based test system that looks at hormones across the cycle, and we analyze patterns over time to say, was this hormone elevated for long enough, right? And so instead of just doing a single blood draw, we're doing 4 measures throughout the entire implantation window. And we're looking for sustained elevated, and we don't actually look at progesterone in the urine because it's not in urine. It's the metabolite or the marker of progesterone called PDG. Just remember, is it high enough long enough? And if it drops too soon, that's an ovulatory issue that could be preventing you from getting pregnant or staying pregnant.
So I have a question. If we just go back to your time when you were struggling with infertility, and I guess you had kind of 3 years, you got pregnant with the first one, and then the second one, you started to know that you had at that point figured out that you had the luteal phase defect. Did you in fact also suffer from like premenstrual spotting, terrible PMS? Did you notice any of those additional symptoms at the same time?
Yeah, absolutely. I definitely had spotting. I've always had heavy periods, so more of like an estrogen dominant, like low progesterone, headaches around cycles. But yeah, those were the biggest ones. I don't necessarily have like the mood, like the PMS mood. So I definitely have, cravings and bloating and all that kind of stuff. But yeah, absolutely. Spotting was a big one as well.
So there's so many telltale signs that our body gives us every day throughout our cycle that are going to, I guess, in fact, help confirm. Like when I work with clients or what I teach my clients in my community is to kind of, I teach the fertility awareness method. So taking the basal body temperature, because you can even cross-check that with again, getting your progesterone levels tested 7 days post peak, not necessarily on 21 days after your day one of your cycle. There's so many small little caveats that women need to understand so that they can take this information and then be able to analyze it in a way that is going to empower them and be able to advocate for themselves better when they go to the doctor. So I would love to hear more about um, the so you're can you talk to us a little bit more about the testing in the luteal phase? So you're saying there's 4, so you're testing the metabolites of the urine. Can
Mhm.
you explain why you kind of briefly did, but can you get a little bit more into what that means?
Yeah, absolutely. So estrogen and progesterone are oil soluble hormones, and your urine is water soluble. And so in order for those hormones to be passed, they have to be metabolized by the liver, which puts on that hydrophilic property to it so that it can dissolve in your urine and be passed through your system. And so you don't see progesterone or estrogen in your urine. You see the metabolites of it in your urine. And so what we did is we looked at tons of research, mainly from NFP doctors, NAPRO physicians that have been studying the cycle for, since the 50s and 60s, that have studied these urine metabolites and how can we monitor in a non-invasive way. And so I went in and I looked at all this literature about, what is a healthy cycle in a proven fertile woman, and what are the metabolites supposed to be, and how do you measure them? And so our first product is the Predict and Confirm kit, which is the LH test to predict. It's the ovulation predictor kit, and it measures the LH surge, which typically happens, 1 to 2 days before you ovulate. It's not always true, but typically it shows, this is you're about to ovulate. And then we do the PDG testing, which is that progesterone marker, the metabolite in urine. 7, 8, 9, and 10 days after that LH surge. So again, it's post peak. So we say DPP days post peak in our 7 to 10 day window. We don't say cycle day 21, 22, 23,
Right.
24, because we know not all
Good.
women ovulate
Yes, on day
cycle day
14. Yeah.
14. Exactly. And so basically what we do is we pair these urine test strips with a free app on either Android or iPhone. You download it, it tells you, you put in your cycle stats, so how long's your average cycle, when was your last period, and it says, okay, today's an LH testing day, and you scan it in, you like use first morning urine or other urine, take the test, and then you lay it on the card and you snap a picture of it, and then it reads the test. So we have machine learning and hormone concentration curves on the back end, so we can get at hormone value. And then we say, okay, your LH value was 15. It's not positive yet. Try again tomorrow. And then she'll test tomorrow and it says your LH is 35.5. This means you've positive, you've hit your peak fertility day. Come back in 7 days and do your PDG test. And it goes 6 days, 5 days, 4 days, right? And then it says, hey, today is a PDG testing day. And then what we do on the PDG testing days is we do 4 days in a row, which is 7 through 10 days past ovulation is when typically implantation happens. This is when you want progesterone to be high and remain elevated to have a healthy luteal phase. So we check all 4 days and we either score them as a negative or a positive result. And then we give you a score, like a report card of your ovulation at the end of the cycle. So you can have a good ovulation, you can have a bad ovulation, you could have not ovulated, you could have ovulated. And it really depends on that kind of that prolonged hormone secretion that you have to say, was it an A plus? Was it a 90 or 100 ovulation, or was it more like a 60? Are you kind of failing because you're not making enough of this, really awesome hormone? And so we basically analyze all the data and give you this report card at the end. And then, tips on, okay, how can you eat for your hormones? How can you exercise for your hormones? What kind of supplements? And just natural ways to kind of create a healthy cycle, which, like you said, is the 5th vital sign. It's so important for just to thrive. We have so many women on our team that are not trying to conceive, that track their cycle because they know. It is.
It's so much fun. It is. You're like, what's going to happen this month?
Yeah. But they like plan certain meetings around when their estrogen is rising because that's when they're most creative and they're most like,
I do the same thing with my business. That's exactly what I do as well. It is the most empowering thing for women to understand their cycle. And I think now we're also living in a time where there's so much more well, obviously we've come into this technology only in the last couple of decades. None of this was available before that, right? So we're so lucky to be living in a time with this at our fingertips to give us the tools to be able to understand it. So those 4 days. So if we go back to you're measuring the progesterone metabolites in the urine for those 4 days. Now, as we know, progesterone in the luteal phase is kind of like a bell curve, and it's the bell curve at the end. If you're not pregnant, it's going to drop down, and that's when you get your period again. So over those, I love that you're testing it over like a 4-day period as opposed to just finding that kind of 1-day mark, because I've got a lot of clients and we track their cycles, and you can even see with their temperatures. Like if you do this and decide to do your BBT at the same time, it's so interesting to also see the parallel between because I get clients to test their progesterone serum sometimes multiple times if they're really dealing with, we think they're dealing with low progesterone or luteal phase defect, and we'll be able to see if their blood, that their blood markers are not in the optimal ideal range for each day, because it's going to be different depending on the day. And their temperatures also are pretty much reflecting what their blood serum says. So I'm assuming the metabolites are probably the exact same. It's going to show, so you're saying those metabolites are going to either be higher, lower. You have your optimal range of what it's supposed to be on each day for those 4 days. And if it's maybe one cycle, your corpus luteum is doing real good with pumping out that progesterone, and you're going to get a good score if it's in the optimal range. But some months, maybe you're really stressed. It's a poor quality egg, so corpus luteum isn't working as well. And so you'll say that if those markers are lower, then you're going to get a poor score because it's not in that optimal range of what the metabolites will be.
Yeah, absolutely. You got it.
That is fun. I want to do this.
Yeah. One other thing that I like to mention is it's not a 1-for-1 blood to PDG level, because urine and blood aren't the same. So if you think about your ovary and your brain, so your brain is the one that sends a signal down to the ovary to produce progesterone. And so it's a negative feedback loop. So basically, once the brain senses there's not much progesterone in the system, sends out a signal down to the ovary, it's a big bolus of progesterone that gets released. And so you have these cyclic patterns of release of progesterone. And so if you're going in for a blood draw, you don't know if you're at the high point or the low point of those swings. And that's why they've done I want 3 or 4 measures of progesterone. I'm going to add them together and divide by however many you had. And if it's, averages of 10 nanogram or above, then you're good. And so what we do is we use first morning urine, which is basically a snapshot because it collects in your urine through when you're sleeping. And it's a long enough period of time where we can take those peaks and valleys and it averages out and then it shows up in your urine. And so it's more of a consistent measure of the average over time, or like that last kind of 8 hours that you were sleeping. That coupled with 4 days in a row, it's really like getting on the idea of, is it a healthy luteal phase? Is it a healthy ovulation, right? We call it successful ovulation because there's ovulation and there's what we call successful ovulation. So ovulation by itself is release of an egg. Successful ovulation is release of the egg, release of enough progesterone to have a healthy cycle. Healthy cycle is important for trying to get pregnant, living a life, right? Thriving, like
of happiness. Yes.
Having a healthy period, right?
Yeah. Yes, absolutely. No, it's the menstrual cycle is like the cornerstone to women's health. So like this, we were built in with this mechanism to allow us to procreate. That's what we're designed to do. And at the same time, it's our monthly report card on how well our hormones are doing, which are going to dictate how well we sleep, what our mood is like, how well our metabolism goes, our immune system, everything is connected. It's all connected. We know this. So I love that this is a great piece of technology that I guess helps give you even more information. And like you said, it's I've got some notes here, but I'm looking and it says how to get pregnant on a budget, because I know, like you said, and I experienced this with a lot of my clients, but there is a big price tag to some of this, depending on where you are in the journey, how long you've been on it for, and all of those things. So can you share what is the price range of Proov? What does it look like if somebody wanted to start using it?
Yeah. So the price of Proov, you just want the PDG test, it's $29. If you add on the LH tests, it's $39. If you add on estrogen to give you that longer fertile window, and then you add on FSH to look at ovarian reserve. So you really look at the complete cycle. This product is called Proov Complete. That's an $89 product because it really gives you so much rich data. So it really just depends on kind of what information that woman is looking for. But really it's about not waiting until the last moment. I mean, like if I go back to my journey and I think about it, I was like, okay, I'm just going to buy the cheap ovulation test off of Amazon, and I'm just going to get a cheap thermometer, it's $7 off at Target. And that's all I did. And then I was just so frustrated and so distraught that I got down to it and I had to pay $40,000 in IVF, right? Like that's basically what was my journey, where it's like, okay, if we become more proactive and we think about additional testing, and if I had gotten, more testing done sooner, could I have changed that journey? Could I have avoided IVF? And so we see this a lot. It's very, very common where women, and I totally get this, we are like, how is this fair that I have to spend money on fertility products and my neighbor across the street has 6 kids and she's never struggled? It is totally unfair. And so you get into this, like, well, I'm not going to spend any money. This is, it's too expensive. And then they go down the IVF route. And it's like, right, if you can step back and just say, okay, can I invest in myself now so that we can hopefully prevent that? I mean, we prevent about 50% of IVF in women that come to us they're like, for whatever reason, they're like, I can't afford it. I don't want to do it for, religion, or I'm not located near a center, whatever the reason, we can help a lot of them not have to do IVF. And it's just about learning about their cycle. We want to be that in-between space where it's try natural, ovulation support, whether it be, supporting it naturally, whether it be medications, ovulation induction, like just help, supporting a healthy cycle, and healthy sperm for that regard too. We have a home sperm test that looks at motile sperm, because men are 40% of the issue.
Oh, yeah.
And us women should not put that entire burden on us. We need to share that burden with them. And so, supporting, sperm health as well, and doing these things can prevent a lot of reasons of going into IVF.
So I'm curious about your sperm test. Is that something, what do you test on the sperm analysis? So this is an at-home sperm analysis
Yes.
test kit?
Yeah. Yeah. So it tracks motile sperm, which are the two biggest, the motile sperm count, which is the biggest factor to natural conception. So you need to have sperm, and you have enough of them, and they need to swim towards the egg to fertilize it. And so what it is, it's a home kit, comes with 2 tests, and it's this little microscope. And so you collect the sample, and you like mix it with this little reagent, and then you put it in the little microscope slide, and it takes a video of the sperm, and it counts them as they swim, and it gives you a score. It says you have 0 to 100 again. And it says, compared to other men that have fathered children, what is your motile count? So it gives you a number, and then it gives you this little gauge. And so if you have a lower than normal count, you can do lifestyle changes, simple things like changing out briefs for boxers, right? Quitting smoking or drinking, or, taking certain supplements to help with sperm production. But it's affordable. It's under $100. It's $80, $79.99 for 2 tests. And it's the most affordable sperm test that gives you good parameters. The other comparable ones are like the Legacy or Fellow or something like that, where it's like 200, 250, and you like take a sample, send it away. Those will do much more things like morphology and everything else.
Exactly.
Those are only important if you really want to do like IVF or something more advanced. If you're just doing natural conception, this lower priced option is just as effective.
Yeah, sperm. I talk a lot about sperm health as well. There's been a bunch of episodes on sperm health, and I always say we have to share the responsibility with our partners. So if anybody who is thinking about conceiving, especially within the next year, like just start taking, I guess, responsibility or control of your preconception health now. And these are some great tools that can be used just to kind of gauge and see where everything is at. And like you said, it's can be intimidating having to go into the doctor. I just did a couple episodes ago. I talked all about what blood labs to test when you're trying to conceive, and the amount of challenges that I hear from my community members, just like you, when you were telling the story. I was like, yep. We're not going to test you for these hormones. That's not necessary right now. Like, women just want to go in and get their blood test just to be proactive. But they won't do it. They just won't do it. Then they've had miscarriages, go back. Nope, you need to have at least, I usually hear 2, but you said 3. So it's challenging. It can be very challenging. So we're very grateful for this incredible product. I'm really looking forward to again sharing this episode when it comes out. I would love for you to tell, if you have any, like, what would your number one tip or piece of advice be for the listeners? Because this is the Ultimate Pregnancy Prep Podcast, so most of our listeners are trying to get pregnant. If you could give them, one final tip or piece of advice to walk away with, what would it be?
It's to listen to your gut, to listen to your intuition. Typically, if you feel something is not right, there's probably not right. And if you do go to a physician, somebody you trust to help you, and they turn you away or they're not giving you the right answers, there's plenty of other places that you can go and things that you can do. I don't really like taking no for an answer. I like saying, okay, well, that door was shut. Where am I going to find the open one? Because there are a lot of supportive people out there that can do it. I also just wanted to mention we have a product on our website. It's called the Hers and His Kit, and it's basically like a one-stop shop for assessing everything that you basically can do at home without a blood test, to just check off all these boxes of conception. It's under $200, but it's a really good place to start. And so, the most successful people that I've seen are the ones that take that proactive approach, and they just, check boxes or identify issues sooner. I mean, one of my favorite stories is, I had gone through my journey, and I had invented Proov, and my sister, who's 8 years younger than I am, got married. And the first thing she did, she called me up and she's like, all right, I took my Mirena out. What do I need to do? I'm a teacher. I want to get pregnant in August. Like, she had this whole
She had the
plan
whole
out.
plan.
Yeah. Yeah.
She's a
Yeah.
teacher. Of course she has the plan. Yeah.
Yeah, exactly. And so, like, day one, she was like, well, she took 30 days to get, all the hormone stuff out of her system. But then, like, she went in and she looked, and she had a progesterone issue. So I don't know if it's genetic or whatever it was,
I
but
think, you know what? So many women have progesterone. I think it's just
it's
stress that we live with right now.
it's
It's
really common. We
it's
did a
so
clinical
common.
study. We did a clinical study, and it was 58% of women had a progesterone issue. Now, they were women who were trying to conceive, so we don't know how many of those were. We don't know how, like, normal population is, but,
Right.
like, of women that were trying to conceive, 58% of them
That's
had some
huge.
type of progesterone deficiency. Yeah.
That is huge. I see that. I mean, I see this all the time in my practice. This is one of the most common things that I deal with in my practice.
Yeah.
And just being a female myself and having a lot of female friends, like I talk about periods all the time. Like, you want to talk about your period? Come talk to me. I love talking about it. So it's whenever my friends complaining about something, like, hold on a minute, where are you in your cycle? Because it's always like the first thing, right? They're complaining, this hurts, that hurts, they're tired, they're pissed off about something. Like, where are you in your cycle? Let's step back for a moment. So yeah, 58% doesn't surprise me. But it's
Yeah.
scary.
Yeah. We've had
Yeah.
some doctors that are like, that's not right. I'm like, I think it is. I think you're just ignoring it. Right.
So you have this kit that will help you identify this up front if that's the case, because it does take some time depending on what route you want to go, whether it's progesterone suppositories, whether it's progesterone cream, whether it's taking supplements. Unlike a lot of conventional medicine, it's not an overnight quick fix. It can take a little bit of time. It can take a little bit of time before the body is able to change itself. So yeah, start up front. So that's a great piece of advice. Listen to your gut.
Yeah.
Thank you. Thank you so much, Dr. Amy. And we'll make sure to put it in the show notes, but where would somebody find this if they wanted to utilize it?
Our website's the biggest source. So it's proovtest.com, Proov test.com. We're also on Amazon. And we will be launching a major retail location in the US in a couple months. We're very active on social. One of our pillars is education. So we offer a ton of education. So sign up for our emails, follow us on Instagram. All of our social handles are at ProovTest. But yeah, we also have a support group on Facebook. So it's over 10,000 women strong. They come in and talk about the results, other things, and support each other along the journey, because that's something that I'm very passionate about, is you should not do this alone. Mm-hmm. So whether you're doing it real life friends or internet friends, you need somebody to kind of hold your hand along the way.
Yeah. Thank you so much, Amy.
All right. Thank you.